Alright, I'd like to show you an example of just the difference a scan can do in 24 hours. So this client has had plenty of scans before. It has a long history of TMJ. TMJ is a joint in the jaw, and when stressed, it causes people to grind their teeth and do all kinds of things in their sleep. Usually causes a lot of pain, discomfort, unable to eat solid foods. It can be really debilitating. This person's had a long history of it since I think they were 12 years old when they were first diagnosed and treated. A lot of times severe cases like this one are treated with painkillers and muscle relaxers. There's not a whole lot they can do surgically. So this is an example of the client hasn't really had their TMJ flare up for a couple of years. And last week they had a very stressful week. They had something happen in their job. They had some stressful things happen to some friends. It was just a very emotionally traumatic week. And all of a sudden, now their TMJ flares up. Yesterday they had difficulty eating anything but soup, and so a lot of pain. And so we did 3 scans, and I'll show you what we found. So the first thing we did is we looked for what muscles are being affected most. So this is a little about what the temporomandibular joint, or the TMJ, is. These are the particular body parts that the Quest came back with that are most affected at this time, that need attention. So these are the 4 body parts right here. And so we put those in here, and then we did a body stressor scan to see what things are testing against it and causing stress on those joints and ligaments, whatever they are. So we found there's some energetic pathways here that need a little clearing, a little congested. Got some adrenal stuff. These are different elastic cartilage. There's some cartilage certainly between the jawbone, the mandible bone, and the skull. So that's what we found here. Muscles, tissues, cellular. Something with the eye there. Something came up causal. Also the vestibular glands. The body came back that they like those signatures, so we put them in there. There's some more energetic points. We have some SIT and some weaponized pathogen stuff. Not surprising that that's causing a problem. Here's an interesting one. So this is symptom emotional correlation, as you can see on there. And so the reason that more than likely, especially knowing the backstory, is that this client is having TMJ problems are emotions. And so the number 2 problem that we see in this one is subconsciously wanting revenge. This person, the client, saw a lot of their friends get let go from their job last week, and it really bothered her to see that happen. So it would be totally normal to see your friends get hurt and lose their income, that they might want revenge on their behalf. And that's what we're seeing here. So we know that psychologically and emotionally that is the problem that came back most causal. And then we have some homeopathic blends that came back here that we can just put in the imprint. Those are already formulated, so we'll just put they came back causal, so they'll help about, and we'll put those in there. We have an imbalance affecting the silver cord. That's a spiritual problem. And then spiritual, a place signature. So this is probably the place of employment where this client works. That place is the location that they are at, is or going to, is opening a door for spiritual problems. This place is an extreme negative influence on you, and you need to avoid it. It seems likely that this person's place of employment is probably that place, is the best guess that we have. Then we have a homeopathic support for mumps. So this is for uncomfortable feelings of the jawbone and swelling of the parotid glands. Often the swelling occurs unevenly or on one side. So those are the things we came back with this scan. And so we'll show you the next one. We also did a baseline scan. So these are the energetic signatures that came back weak. We'll come back to this. So connective tissue, lungs, the muscles, and the teeth are all in a stress state. So the next one we did was we'll dig deeper into the emotional aspect. So this is one of the emotional scans we can do, and this is super interesting. So what we found is the emotion causing the greatest need for balancing right now is dominating. This person's feeling dominated, probably. I don't think they're the ones doing the dominating. I think they're feeling being dominated. The feelings created this issue is feelings of hate taking form. Again, we discussed what the client stated happened to them last week. They're not feeling very warm and fuzzy to the situation of their friends being let go from their employer. It involves money. Had a money connection. It's their income. Makes total sense. Negative emotions are the factors, and it's affecting their skeletal system. Represents our feeling of being supported in life, so supported financially makes perfect sense. And then the affirmation is, I need to learn to listen with my soul. So they should reflect on that as an affirmation and see where the Holy Spirit takes them with that. So the solutions that we can do to this are, we have Bach flower essences. So this is pink impatience. This says down here what this is good for. We have sclerin, whatever that's called, and that's for those unable to decide between two things. First one seems right, then the other, often presenting extreme variations in energy or mood swings. So that came back as a helpful Bach flower essence. A calming essence. It's an emergency rescue formula which is gentle, calming, stabilizing in a wide range of stressful situations, made with a traditional blend of rock rose, impatiens, clemens, cherry plum, and star of Bethlehem. That is a Bach flower combination. We have white chestnut for constant, persistent, unwanted thoughts, such as mental arguments, worries, or repetitious thoughts that prevent peace of mind and disrupt concentration. And then we also have the white spider orchid, which you can read about all that down there. So all these things, we put the energetic signature of all of that stuff, especially the Bach flower essences, and it came back, and we'll also put that in the frequency imprint. And the last one is those 4 weaknesses that we saw in the baseline. We ran a body stressor test to try to balance those parts of the body, and so this is what we came back here. Some energy points, some stressors, some more energy points. Emotion of feeling betrayal goes back to exactly what we would expect. This is a very emotional problem. So there's some other things that can help, but this is what we see here. With the skin and the teeth especially, we have a lot more weaponized pathogens. So those aren't helping. And then we have a soul filter problem, a weak will. So problems with the soul. The soul is a function of the mind, will, and emotions. It is a translator between man's spiritual being and his physical being. It works best when submitted to man's spirit, which in turn is submitted to God's Torah and Holy Spirit. So weak will produces a lack of discipline, binge eating or drinking, addictions, laziness, and cowardliness. And the client did state that they are stress eating. So that would probably explain that. So there's a person's signature. That's a spiritual filter. This indicates that a person is having a negative spiritual influence on this client. Some people harbor extreme negative energy, and if your own is not positively stronger, you will be pulled down. This person is very likely overpowering your free will and forcing you consciously or through mental manipulation to avoid that person or find a way to release the negative hold they have on you. Find your own free will. So the client needs to figure out who that is, and they need to pray over it and try to release that negative energy or avoid them. And then we've got some more weaponized pathogen stuff. So we took all 3 of these tests, we put them in the frequency imprint, and drum roll, 24 hours later, 80% better. So they took 12 drops of this as needed. So they probably took it once before bed last night, and then I don't know how many times today, but when I talked to them I don't know, 24 hours after we did the scan, they said it was 80% better. And then of all the years that they've had TMJ, they've never had anything that worked this well. They would take ibuprofen and Tylenol and get almost no relief. And we're 80% better with just taking a frequency imprint. There's been no drugs. There's been no pharmaceuticals. There's been no even essential oils. It's just been praying on it, reflecting on the situation with the frequency imprint, discussing what we found. And in 24 hours, it's 80% better, which they've never had before. So this is just an example of what this alternative type of therapy can do. It's fast, it's reliable, it works, and it all makes sense when we understand how the body works. Thank you.